Dr. Tutula Balfour, she has been one of our real leading lights in our health and safety sphere as the Minerals Council. On my right-hand side, I've got Alan Sekom. He is our head of communications, and he's kept me very busy at the Indaba, and I think kept you all quite busy. So just a couple of quick points. We're going to give a quick briefing on safety specifically in the sector. There was a section on what we're doing on health, but I don't mind if Tutula also adds a few ideas in on the health side. It remains a very big focal point. As discussed previously, we do have of our staff members, nearly half of our staff in the Minerals Council are focused on health and safety. Nearly half of our budget goes on the health and safety issues. But on the mine safety side, after 2 years of regression in safety performance, we had a special board meeting of the Minerals Council in December 2021, and we developed an 8-point strategy to halt the regression that had taken place. Just to highlight the numbers, in 2021 there were 74 fatalities in the mining sector. That's 74 people that didn't go home, 74 people who are the breadwinners of families who are not with their loved ones, and we fully are obviously very sad about what has happened. There were 60 fatalities in 2019, and there were 51 the previous year. So we have had 2 years of regression. And this year, so far, we've had 15 fatalities, although it might be 16, depending on Ed's number that he gave me the other day. But we're just checking up on the details of that at this particular stage, compared to 18 in the same period last year. We almost had a fatality-free quarter from falls of ground, but it appears that there was one fatality that Ed Stoddard brought to our attention, who subsequently passed away, still in the quarter. So we've had a tremendously focused set of initiatives from the Minerals Council side at leadership level, and we've agreed to embark on 8 specific interventions. I did touch on a couple of those a bit earlier. The first one is visible felt leadership at mining operations. The second one is stopping unauthorized and uncontrolled access to old mining areas, which are not routinely mined, and to obviously rigorously and effectively conduct what we call proper risk assessments and implement controls where work in previously mined areas is routinely undertaken. So effectively, what happens is that mine workers going back into an area that hasn't been mined for a while, really being very careful that is all the risk processes are properly done to make sure that we don't end up having, because that is where we found over the last couple of years quite a lot of challenges. Quality and scheduled maintenance programs, deploying competent and skilled people, employees in areas of high risk work to provide adequate supervision and oversight, and undertaking quality and scheduled critical control monitoring. Critical controls are always a significant issue in the sector, and assurances to prevent falls of ground, transport-related accidents, and obviously the inundation in working areas. We've also been looking at ensuring that incentives and bonuses for miners do not compromise their rights to stop or refuse unsafe work. It's quite an important issue. Implementing sufficient fatigue breaks and monitoring, and conducting phased onboarding, particularly after holiday periods. People come back and they're a little bit relaxed about issues, etc. You want to really try and manage that circumstance. We had significant commitment from the board members to the MineSafe 2021 commitments that we agreed jointly with the DMRE, organised labour, the professional associations, and we are working quite strongly with the professional associations, so the Mine Managers Association, the Colliery Managers Association, etc., to really continue on our journey on the safety side. But let me stop there. Tutula, Dr. Balfour, would you like to add any words on the safety side, and then we can also maybe touch, because I know you did give a briefing earlier this week on the COVID side, but you might have a couple of thoughts on other health-related issues that we are managing.
Okay, thanks, Roger. I think on the safety, you've really covered quite a lot, everything, so I want to add. I'll just talk about health. The key challenges in the mining industry are occupational lung diseases, which manifest as silicosis from silica exposure in gold companies, and also coal workers' pneumoconiosis in the coal sector. So that's the one set, occupational lung diseases. The next is noise-induced hearing loss, which is from excessive noise. And the last set is, a combination of occupational diseases and public health conditions, which is TB, HIV, and we also monitor non-communicable diseases like hypertension and diabetes. For instance, our workforce is aging, and in South Africa, if you are over 40, the chances you have a chronic disease of lifestyle, about 20% of people over 40 have a chronic disease of lifestyle like hypertension. So because the workforce is aging, that is coming through as a major issue. And also mental health is something that we do look at. A lot of our work is driven by our tripartite agreements with through the Mine Health and Safety Council. We have targets, milestones, which are set to be achieved by 2024. And the initial ones were 2013. We find this quite useful, actually, to have the targets. And currently we have targets on the pneumoconiosis, such that we are aiming to achieve that 95% of measurements should be half of the, the legal OE, occupational exposure limit, which would then lead us to really reduce the number of people that have got silicosis. And on all of these, the pneumoconiosis, coal workers' pneumoconiosis, silicosis, coal workers' pneumoconiosis, TB, HIV, we have got milestones. So I thought I would talk a bit about how we've performed regarding occupational diseases. We have seen a very steady decline in occupational lung diseases. For instance, from 2010 to 2020, we have witnessed about a 73% decline in diseases. A lot of it is TB. TB accounted for quite a bit. For instance, maybe you'd have 4,000 cases of TB out of a total of maybe 7,000 occupational diseases. So our efforts in reducing TB have actually led to a massive reduction in the number of cases of occupational diseases. Now, if I just take each of these in terms of how we're performing towards reaching the 2024 milestones, on the silica dust and coal dust, we seem to be on track. It's quite possible that we will reach those milestones. On the noise-induced hearing loss, in terms of the pieces of machinery, we've had a massive reduction, through replacement of noisy machinery, the Buy Quiet initiative, where really you need to eliminate noise at the source rather than giving people hearing protection. And so we have seen a lot of companies eliminate noisy machinery. On the HIV counseling, we haven't reached the target of 100%. The target is 100% counseling of all employees every year. We are on about 70%. We had reached higher levels in previous years, but COVID also did have an impact on our medical services. So we do need to improve on, now that COVID at least is under control, we do need to improve on focusing on things like the HIV counseling and the TB screening. The TB incidence, we are doing very well. We had aimed that we should be at or below the South African incidence rate, and as an industry, we are below that now. From about 1,068 cases per 100,000 in 2015, we are on about 227 cases now in 2021. And as I said, part of it is the HIV programs. If you have a robust HIV programs, people tested, treated immediately, then you really reduce the TB. And so you are just left with the residual around the exposure to silica dust. which would then mean that we do still have a slightly higher rates of TB in the gold industry. So overall, our aim is to, eliminate the exposures. We have a Mosh Learning Hub, which is about promoting learnings from companies which are doing well on all of these areas. And we find leading practices that are then promoted throughout the industry. So that's what we do, but also now we are also concentrating on real-time monitoring, which means that, you have instruments which on the mine can pick up if there are excessive levels of whatever exposures, whether it's noise or it is dust levels. And so we also have Masoyise Health Program, which is our program to address TB, HIV, and the non-communicable diseases. I won't go in depth on that. There is material on our website on Masoyise Health Program, but just to say that we are making progress through all of those initiatives. Thank you.
Dr. Balfour, thanks very much. Let me hand over to Alan.
Colleagues, just so you know, with the fatality we had at Kasasa Letu a few days ago, the industry fatality rate is 19 compared to 18 from a year earlier in exactly the same period. So until that accident, we were doing really well, in decreasing the number of fatalities.